Welcome back. In today's Get Healthy, we're looking at some new guidelines from the American Heart Association about the ideal blood pressure. They recently redefined the threshold for blood pressure to 130/80 instead of 140/90.
Joining us to explain what that means for you is Dr. Catherine Strelich, a cardiologist with Kaiser Permanente. So not a massive change, but definitely a change for those people with hypertension. So why the change, doctor?
Well, one of the things that the American College of Cardiology and the American Heart Association try to do is incorporate data from clinical trials and from experience and translate that into guidelines, and that's what they've done here. So there was a major clinical trial called the SPRINT trial that was published a couple years ago.
Right.
And in that study, they actually took half of the patients in that study and tried to lower their blood pressure to the old guideline of 140/90 and half to a lower blood pressure of 120/80. And it was the results from that study that really prompted this change.
Prompted the change. What are some everyday things we can do just to stay healthy and keep it where it needs to be?
Right. Well, I'm glad you brought that up because these new guidelines do increase the number of people who are now, by definition, hypertensive. But many people who have a blood pressure of 135/85 don't want to start a new medication.
Right.
So there are a lot of things we can do, fortunately, with our lifestyle and diet to lower blood pressure.
What are some of those things we can do? Just some easy takeaways.
Yeah, probably looking at the diet first, trying to increase fruits and vegetables in the diet, trying to limit sodium in the diet. And one thing people maybe haven't heard of is that increasing potassium in the diet can actually lower blood pressure. Trying to avoid fast food, processed foods, lots of added sugar, those things can help as well.
Do you anticipate seeing a change in the amount of people, though, being prescribed medication for hypertension? Or do you think the people who would show up with a higher blood pressure would have been on it before? I guess with the change to the recommendations.
That's that there probably will be more people now being prescribed antihypertensives. Interestingly, the group that's probably the most affected in that is people who are younger, people between the ages of 20 and 45 who now are normotensive will be diagnosed with hypertension. And if lifestyle changes don't result in a lower blood pressure, they might be prescribed medication.
Now, would you recommend, I oftentimes at the gym or at a store and I see that you can test your blood pressure, are those pretty reliable, would you say?
You know what, actually home blood pressure monitoring and at Target or one other, at the gym, it actually is quite reliable.
Okay.
And these new guidelines take into consideration the fact that a lot of people are actually checking their blood pressure at home or at the grocery store. So we do encourage people to keep track of their blood pressure. And you can see on the cuffs that you purchase if they've been kind of accredited or approved as being reliable, and they are quite reliable.
All right, Dr. Strelich, with great information today. Thank you for coming in. How often do you recommend people check in with their doctor?
Every 3 months if they're being treated actively for hypertension, and at least once a year if you're just being screened.
Okay, wonderful. Again, a cardiologist with Kaiser Permanente with some great tips today. Thanks for being here today.